Some memory problems aren't aging, they're side effects. After 60, one of the most unsettling fears doesn't arrive as a dramatic moment. It arrives quietly. You walk into a room and forget why you're there. You lose a word mid-sentence. You repeat a story and don't realize it until someone gently points it out. And what makes it truly frightening is not the forgetfulness itself. It's the question that follows immediately after. Is this just normal aging, or is something starting to go wrong? Most people try to push that thought away because once it appears, it's hard to silence. Memory feels personal. It feels like identity. And the fear of losing it can be far more disturbing than any physical pain. What almost no one talks about is how often this decline is quietly accelerated, not by aging alone, not by genetics, but by medications millions of people over 60 take every single day. Prescribed, approved, trusted. Medications meant to help you sleep, calm your nerves, control allergies, ease bladder issues, or manage mood. Medications that may seem harmless because they've been used for years. And that's exactly why the danger is so easy to miss. Because memory problems caused by medication don't show up overnight. They creep in slowly, blending so perfectly with aging that most people never suspect the real cause. The brain after 60 becomes more sensitive. Blood flow changes. Neurotransmitters become more fragile. The brain clears chemicals more slowly than it used to. So substances that once caused no noticeable effects can suddenly begin interfering with focus, recall, and mental sharpness. This doesn't mean the medication is bad in a dramatic sense. It means the aging brain responds differently, and no one warns you clearly enough about that shift. One major group of medications known to quietly affect memory are those with anticholinergic effects. Many people don't even recognize the term. Yet these medications are everywhere. They're often used for allergies, sleep, bladder control, nausea, and even some forms of pain. These drugs work by blocking acetylcholine, a chemical that plays a critical role in learning, memory, and attention. In younger brains, the impact may be subtle, but after 60, when acetylcholine levels naturally decline, blocking it further can create noticeable mental fog. This is where many seniors begin to feel something is off. Concentration feels harder. Names don't come as quickly. You may feel mentally slower, less sharp, or less confident in conversations. And because these changes don't feel dramatic, they're often blamed on stress, poor sleep, or age itself. The medication remains unquestioned, even as memory quietly worsens month after month. Another category that deserves serious attention includes certain medications used for help with sleep and anxiety. These drugs can be effective at calming the nervous system, but that calming effect doesn't always stop where it should. Over time, they can suppress brain activity in areas responsible for memory formation and recall. This is why some people notice they sleep better but feel mentally dull during the day, or why memories from recent conversations feel fuzzy, while older memories remain clear. What makes this especially concerning is that poor memory itself increases anxiety, so the very medication meant to reduce worry may indirectly create more of it by interfering with mental clarity. This creates a loop. More confusion leads to more concern, which leads to continued or increased reliance on the same medication, while the real source of the problem goes unnoticed. A third group of commonly used medications that can affect memory includes certain drugs prescribed for mood, pain, or nerve-related symptoms. These medications can alter neurotransmitter balance, slow reaction time, and reduce mental alertness. Again, the effect is rarely sudden, it's gradual. A little more forgetfulness here, a little more mental fatigue there. And because these medications are often taken long-term, the changes are assumed to be permanent rather than reversible. What's deeply unsettling is how rarely medication-related memory decline is discussed openly. Doctors are often focused on treating immediate symptoms. Patients are reluctant to question prescriptions, and memory changes are brushed off as an unavoidable part of getting older. But research and clinical experience continue to show that medication burden plays a much larger role in cognitive decline than most people realize. This doesn't mean you should stop taking medications on your own. That's not the message. The message is awareness. Because once you know that memory can be influenced by what you take daily, a new door opens. A door to asking better questions, a door to reviewing medications periodically, a door to recognizing that memory loss is not always a one-way street. Many people who address medication-related cognitive effects report feeling clearer, more alert, and more confident again, not because they reversed aging, but because they removed an unnecessary obstacle their brain was struggling against. And that realization alone can be incredibly empowering, because it shifts the narrative from helplessness to possibility. The most dangerous belief after 60 is that nothing can be done about memory decline. That belief keeps people silent, it keeps them from asking questions, and it keeps them living with unnecessary fear. Memory problems deserve attention, not panic, but curiosity, not denial, but investigation. If you've noticed changes in your memory that don't quite feel right, especially if they began after starting or increasing certain medications, that's not something to ignore. It's not a sign of weakness, it's a signal worth listening to. Because protecting your memory isn't just about the future, it's about preserving clarity, confidence, and independence right now. And sometimes the most important step isn't adding something new, it's understanding what might be quietly taking something away.